Today, I declared a public health emergency in Scott County, Indiana, due to an outbreak of the HIV virus that has reached epidemic proportions. It orders the state to coordinate a multi-agency response and provides additional resources and tools to stop this outbreak in its tracks. To note that 100% of the 79 confirmed HIV cases have been traced to intravenous drug use.
You know, I'm not the expert on drug use, so let me just legal disclaimer that one. Here in Dallas, one of our biggest problems is meth. And I know there are areas where injectable drug use is a big issue, and I have certainly seen it in my line of work. My name is Damian Narvaez. I am a social worker. I've been working in HIV for about 4 years now.
And what services does the clinic provide?
We provide comprehensive care, so whenever patients are being seen for HIV here, they also get primary care as well. Everything from routine vaccines to colds and flus, and then of course being seen optimally twice a year for HIV care. As a social work case manager, I provide medical case management and community case management. Medical case management involves a lot of care coordination, a lot of DME ordering, getting people medical equipment that they might need, providing a lot of health education, helping, just kind of holding hands through the medical care process. Community case management, in that we can provide access to agencies that require referrals from us as case managers. We can screen the patients, make sure they're eligible, and provide them the necessary documents in order to access those services out in the community.
In recent years, have you seen the number of cases regarding HIV/AIDS increasing?
Absolutely. The rate at which it's increasing is decreasing, which is great. That's due to a couple of different things. The education that has been promoted since the 80s, since the onset of the epidemic. PrEP is now available, Truvada, to prevent infection if you're engaging sexually with somebody that is already positive, or if you're just a known high-risk category, like having multiple sex partners. And then, of course, getting people undetectable, bringing their viral load, the amount of virus in the body, down to an undetectable status, helps to prevent infections, because you seemingly can't pass it on if you're undetectable. And we're getting people undetectable very quickly and effectively now with the medication that's available. But just because the rate at which it's increasing is decreasing, that overall number is still an increase. So yes, every year we have more positive people. I'm a big proponent of needle exchange programs. I think, again, it's not just about getting them into drug treatment eventually, but it's also about linking them to medical care and linking them to mental health care.
My name is Francisco Gomez. I am the coordinator for health outreach programs here at AIN.
How long has AIN been around for?
We've passed our 30th year, so we're now in our 31st year.
And what services does AIN provide?
We provide case management, we provide meals, we provide transportation, and we also provide other health services, preventative health services for at-risk populations.
Do you feel that a city like Dallas, so big, with such a big homeless population as well, do you feel it would benefit from a needle exchange program?
It definitely helps. Any impact or any help that someone can get to prevent a disease can benefit. If it's done properly, people can greatly benefit from that, especially vulnerable populations. Be it needle exchange programs.
Programs that help the population of HIV/AIDS decrease.
It's just a matter of looking into numbers. If you analyze numbers and you see an increase or decrease due to a program, that should be sufficient to at least look into it and be open to it. When that happens and you directly make an impact on these numbers through a program.
Well, it's a story we've been following for several weeks now, an HIV outbreak in the southeastern part of the state. As we've reported, it's centered in 5 counties, but the governor this week called the outbreak a statewide problem and is encouraging, quote, swift action to get the spread of the virus under control. He signed an executive order yesterday allowing for a needle exchange program in Scott County. That's the county all the HIV cases have been traced back to. As Barbara Harrington reports, the needle exchange was part of a larger order declaring the outbreak a public health emergency.
The governor's executive order gets more state agencies, including the State Department of Health, into the affected communities. It also gets more healthcare providers involved in education and testing. The virus is being spread exclusively through IV drug use. That's different than how it's usually transmitted.
Hey there.
Hi, good afternoon. My name is Mirka Estrada. I'm a junior in high school. So at our school, we're currently working on a documentary, and our documentary focuses on HIV/AIDS and what needle exchange programs can actually do to help diminish the numbers of cases. So I was just wondering what your particular stance is on the implementation of needle exchange programs.
Yeah, the questions about needle exchange programs, a documentary that she's working on related to HIV/AIDS, really inspiring that you in high school are taking on these big issues. Let's talk about some of the things that we can do right now. Making drugs or pharmaceuticals, I think there's one called PrEP, more available to more Texans and Americans so they can take care of themselves and be healthy. Allowing for needle exchange programs, which is the right, humane, rational thing to do. That's going to save more lives and allow more people to lead better ones. That's the right thing to do. And then when we were talking amongst ourselves in the campaign and in my office about, well, what if we were no longer haggling over chip reauthorization, or just funding the budget for the full fiscal year, or protecting these 800,000 plus Americans who we know should be in this country? What would we be focused on? And we started to talk about things like curing cancer, or Alzheimer's, or meeting the challenge of HIV/AIDS. Those could be some of the moonshots of this generation. Rolling back the man-made causes of climate change and saving this planet so we can pass it on to the next generation. And I love that you are going to be our conscience in this going forward. So thank you for what you're working on.
And I think that's what people have a hard time dealing with is, you know, they think that it's going to promote drug use, but at the end of the day, what we're really promoting is engagement with providers that can link you to those services, make the drug use a little bit safer, and start to make other things feel better, and sort of build that rapport and trust with that person. The statistics show that the areas, the cities, and sometimes countries in which these programs are implemented, that the harm reduction models are really, really effective at bringing people into treatment as they engage with those programs, and not only bringing them into treatment for their substance misuse, but also in linking them to medical care and other types of supportive services.